So hello and welcome to everyone who is attending this event, which is on Community Hub's delivery points for a new national care service. It's good to see so many of you here. As you know, this evening's been organised by the Commonweal Care Reform Working Group. I'm Kathy Jenkins. I'm a part of that working group and I'm your chair for this evening. I'm also involved in Scottish Hazards, a health and safety activist group, and I'm the health and safety officer for my Unite branch, which unionises social care workers in the not-for-profit sector. Every one of us will be well aware that the Scottish Government consultation on a national care service offers, we hope, a real opportunity to address the myriad problems social care faces and to influence and help shape the future of social care in Scotland. We hope tonight, which looks at one element of that, will help inform that process. I'm not really going to say anything more as we have three excellent speakers, Colin Turbot, Ali Stanley and Craig DL. Robin McAlpine has ended up, unfortunately, double booked this evening, but he is more than ably replaced by Craig, who also works for Commonweal. And I'd like to thank him because he's also hosting tonight on Zoom. I'm going to ask each of them to speak, to keep to 15 minutes so that we'll have a good amount of time for questions. If you have questions, hold on to them because we're going to have all three speakers first, and then I'll ask for questions. So I think without further ado, I will introduce our first speaker, who's Colin Turbot. Colin is a former social worker, trade union activist and writer. He's an active member of the Commonweal Care Reform Group, and he's the author of the paper Care in Your Community, Putting Community Hubs at the Heart of a National Care Service. And I think that Craig's going to put a link to that paper in the chat. So, Colin, over to you.
No, I'm unmuted, you'll hear me. Thanks very much, Kathy. This is community hubs are an idea that you won't read about if you're looking at the stuff that's come out from Scottish Government about the possibilities for a national care service. You won't see this, but it's an idea that we feel could be quite central to the successful community-based delivery of a national care service. So we're going to cover various aspects of that tonight, but I'm going to start by giving you an overview. Community hubs is a definition that we hear bandied about quite a lot. It seems to have suddenly come into prominence over the last few years. I'm a children's panel volunteer, and it's a term that's used to describe the virtual system that children's hearing volunteers communicate with one another. On the other hand, it's also used, I've heard, to describe a vast complex of offices in the northeast of Glasgow that deliver community health services and social work services. Not what I would describe as a community hub, as we'll go on to see. So hopefully I'll be able to move the slides on eventually, because they're not at the moment. Here we go. Right. World War II was a period that saw the creation of a national care service, and the collectivity, the sense of all being together against a common enemy, brought people together, and lots of ideas came along with that. Now, we all know about the NHS and national insurance and so on that emerged from World War II, but perhaps people may not know that there were a discussion about all sorts of other aspects of civic society as well, including, as part of army education, the idea of community centres as being central to community life. So these are ideas that have been around for a long time, and what we hope to demonstrate tonight is that we're just emerging, hopefully, from a catastrophic pandemic that's touched almost everyone's life. And this opens up possibilities too for new visions, new ways of doing things. And certainly, just as it's brought us ideas about a national care service through some of the disastrous ways in which we tried to deal with the pandemic, the deaths in care homes and so on. So hopefully some good can come out of this and we can begin to extend that discussion. So if we look at the history of community centres and community development, as Kathy said, I'm not a community worker, I'm a social worker who's always enjoyed the concept of working within communities and community networks. So community centres have been around a long time. They go back to workers coming together in mechanics institutes, in miners' welfare halls and in village halls. And for some reason, I seem to have lost one reference there, which was to New Lanark and Robert Owen, bringing people together in a centre that he called the Centre for the Formation of Character, not the reformation of character, but the formation of character, bringing together education and community as a central part of focus in New Lanark. So just as these community centres have continued to develop, particularly since World War II, they've kind of gone into the background in recent years because they've been affected very badly by austerity. Some have been handed from councils, local authorities over to community groups. Sometimes that's a good thing. Sometimes it just introduces notions of insecurity into the whole thing. So now we're looking forward to community hubs. So what are they? Well, this is a kind of classic definition. It's a building that's not necessarily a building, could be a complex with multi-purpose, open, accessible to local communities, providing services that people need, and led by a governance structure that is composed of members of the community, and that's a very important aspect to it. So that's the kind of definition that's begun to emerge in the last few years pre-pandemic. And there's a reference there for any of you who are interested, a really good paper that came out pre-pandemic describing the potential for community hubs in helping communities affected by poverty and deprivation and all the other ills that we know so well. So what do they offer? Well, first of all, a community hall and a meeting space, a centre for local health and well-being activities, voluntary activities, and you'll hear about some of that from Ali in a minute, and offices and workspaces for community voluntary groups, arts and cultural activities, and sports and fitness. Those are the kind of traditional things that you associate with community centres. We are suggesting that the experience of the pandemic over, particularly between March and perhaps July, August of last year, suggests that community hubs can indeed offer a great deal more than that, and can also be a conduit for public services, local authority services, particularly, I'm going to argue, social work. So what we saw during the pandemic is community hubs, and that's what they were called in almost all cases, being used as a response centre for meeting need during the lockdown, whether it was delivering food to people or prescriptions or whatever. And it marked a return to a community orientation for a lot of services that had become siloed and distant from communities. It also, I think, highlighted the shortcomings of the one-stop shop model, and that's something that those of you who are familiar with the trajectory of local authorities in the last few years will perhaps be familiar with. One-stop shop sounded great as an idea that you kind of only had to go at one place and you get an answer to everything. In fact, there were little more than centralized signposting operations that removed people from the services that they needed and wanted. So for instance, whereas at one time you'd walk into your local housing office to pay the rent, if you're a council house tenant, where you would probably know by name the person behind the counter who would also know you and perhaps have a word with you if you're falling behind with your rent and offer some assistance and so on. often been replaced, that kind of service, with a one-stop shop where you were meeting somebody who knew nothing about you and not a lot about the service, but would simply refer you on. So that's the kind of idea that we really want to start moving away from. And this is where our idea, Commonweal Care Reform Group's idea of taking the whole notion forward, comes in. So what we think is that the pandemic type of community hub model has offered an opportunity to reimagine how public services could be delivered. And in particular, it's offered an opportunity to look at how social work can come back to communities. Now, I believe that the 1968 Social Work Scotland Act, which was very much linked to communities and what communities could do for themselves, was a very, very good model. I was talking to somebody yesterday about that act, and we were kind of remarking between us that 1968 was a significant year. There were upheaval throughout Europe. There was almost a revolution in France. And in Scotland, we had the Social Work Scotland Act that in some respects reflected a lot of that. And we were thinking that you probably would not get an act as revolutionary and far-sighted as the 1968 Act today, because we've come a long way since then, and we've moved away from all that stuff, and social work has become centralized, siloed, it's become prescriptive and obsessed with risk aversion and risk management, and obsessed with assessments and gatekeeping. And what this offers an opportunity to is to bring social work back to communities. It also, community hubs could be used for carer support. And I know that the government are talking about carer centres, and I've had a look at that online today, and I've noted that carer centres, there tends to be one per local authority. That's the way the funding's been streamed for them, which really isn't good enough, I don't think. And I think we could make services like that far more local. We could make them accessible based around relationships between people that know each other and know and understand the local networks, know how to use them. And that is where the Northeast Glasgow so-called community hub will never ever achieve anything like that because of its sheer size and distance from the communities that it purports to serve. So we need to move well away from call centres as models of social work delivery, well away from that, and move our services back to communities so that they can truly be preventative and not just focus on crisis management and picking people up from the bottom of the cliff when they've already fallen over. So there are opportunities for this. I've already talked about the original, the premise of the Social Work Scotland Act, which is still in place, but could well be repealed and replaced through the establishment of a National Care Service, because it looks as if the National Care Service, I think very, very mistakenly, that's the view of our group, might be based on not taking it out of local authorities. The Christie report 2011 talked about communities. The Community Empowerment Act, although it talks mostly about land reform and community buyouts and so on, does offer opportunities for people to get involved in local decision making. The Scottish Government Social Renewal Advisory Board reported in January 2021 on the lessons of the pandemic and talked about the need to get services back to communities. We've got the concept of the 20-minute neighbourhood, and I know Robin, if he'd been here, planned to talk about that and how a community hub should be centred on that. Nowhere should be more than a proper hub that effectively serves the community shouldn't be more than a 20-minute walk away within an urban setting. I looked at a video this week that's been put online by Healthcare Improvement Scotland. I think they must have been listening in to the conversations we've been having on Commonweal, because it talks about iHubs and gives some very good examples of how services have been brought down to community level across the country. I'm slightly suspicious of some of it. I'm certainly suspicious about the way in which that's health-led. and that fits with the government's concept of a national care service out of local authorities and very much under the influence of health, the new national care service. That's certainly not how we would see things. So really, I'm going to finish at that. And there's some further reading there, and there will be a recording of this. And if anybody wants that list of references, please get in touch. But that's me finished. Okay.
Thank you very much, Colin. That's given us a lot of food for thought. And thank you so much for keeping to time as well, because that'll give us good opportunity to have questions and discussion afterwards. So I now want to move on to our next speaker, who is Ali Stanley. Ali is the lead for Healthy Valley's Resilient People team, who utilize a social prescribing model to offer support to adults and older people living in rural South Lanarkshire. The team's strapline, working together towards better well-being, encapsulates Ali's belief in using asset-based approaches when working with communities and individuals, something which has been her vocation for over 20 years. Healthy Valley was recommended to us by the Scottish Community Alliance as a great example of a grassroots community-based service. So over to you, Ali.
Hi, thank you for allowing me to be here. I've got some slides which I shall endeavour to share, but as most of us will know, you never go to one of these things without the technology not working for somebody. So if you can all just cross your fingers, it's not me while I get that happening, that would be great. Okie doke, are we there? Have we done it? I think so. Thanks, Kathy Russell. I can see you smiling. I appreciate that. So I'd just like to take the opportunity to start with to introduce Healthy Valleys. Community health matters pretty much sums up everything that we do and believe in. So we are a community-led health initiative based in rural South Lanarkshire in what was previously known and is locally still known as Clydesdale. As this says, we providing opportunities to local people to improve their health and well-being. But more than that, we seek to involve people in planning services and to actively work with them to improve their health and well-being. When Colin said earlier that we want to start getting people before they hit the bottom of the cliff, very much that's what Healthy Valleys believes and is about doing. And at the core of everything we do is meeting community-based need and responding to need that we identify and bridging gaps where we need to. We've been established since 2003, sorry, so that's a lot of years of community-based delivery, a lot of hard work, a lot of consistency, a lot of being reliable, being there, and having the community and the individuals in the communities at the core of everything that we do. As an organisation, we have 3 strands: resilient communities, particularly tackle food poverty, social isolation and loneliness through group work opportunities. They have delivered in the past our community cafe work, which were social hubs, but also addressed food insecurity. And they run a lot of our sort of community outreach group works, health walks and those sorts of things, children's summer scheme programmes. Resilient families, Bump Baby and Beyond sums that up perfectly for me. So that's our young people and our new parents. Everybody with children under 5 is entitled to access support by Resilient Families. They do a wide range of one-to-one support, helping to get people to health appointments, midwifery, maternity appointments, things like that. Lots of educational parenting programmes, baby weaning, health through pregnancy, and then they get to do lots of fun stuff. The Welly Waddles is the health walk that's aimed at families and children, and they do lots of bouncing, rhyme, those sorts of messy play. Quite often used to be spaghetti everywhere after they'd been in doing messy play and things like that. And then, as Kathy said, my team, Resilient People. So we support adults and older people to build independence, improve their confidence and mental health whilst combating isolation through intensive one-to-one support and group work. It's quite wordy, that. My team consists of social prescribers and what we call community health navigators. They are a group of people who take referrals from a wide variety of partner agencies, other third sector organisations, primary health, social work, all sorts of places, GPs, and we meet with individuals. We try and build a relationship with individuals where they feel that they're able to start addressing their own health and wellbeing goals, set goals and work towards them. We've always used a social prescribing model at Healthy Valleys. We're part of the Spring National Social Prescribing Project, but it's always been intrinsic to what Healthy Valleys has done, that we've worked to support people to set goals and then to achieve them. I think there's very little point in signposting to people two things, sorry, if they're not able to access the support that's there when they get there. Quite often people need somebody with them to encourage them to believe that there is the chance to make a change and that they don't have to be on their own when they're doing it. So the next slide, she said, fumbling for the thing, says we are trusted and embedded in our communities. And I didn't put that up there lightly because it's quite a statement, that, but we work very, very hard to achieve that and to feel that we can say that about how people view Healthy Valleys. And underneath, we reach people are seen as difficult to engage. Our partners in health improvement and NHS often say to us, we need to get this message out, what can you do to help us? Because we are trusted. People will come to us and will engage with us in things that they wouldn't engage in if it was promoted through the normal sort of statutory health channels. So I wanted to just give what we've done in the last year some context. In response to COVID-19, I think we all will have a COVID-19 story, but Healthy Valleys started with, we had some meetings about the fact that COVID-19 might affect us. And we talked about things like we'll get people to wash their hands more and we'll stop wearing jewellery, and then fairly rapidly realised that was not going to be how this progressed. We were based in a national health building in a decommissioned hospital. And on one Wednesday, they said they might need the building back. On Monday, they said they definitely would. And on the Friday, we sent 20 staff members home, some without computers, with no shared access to a server. We were having meetings on House Party because Zoom wasn't even really a thing at that point. We never missed a step. So the reason I've put the first month of what we did in there was because it was quite remarkable the way the organisation and the local communities responded and how quickly they did. So you can see in that we delivered 1,663 pre-prepared meals. So we worked in partnership with the local cafes who suddenly had no income, had food that they needed to use up, and we got meals cooked and delivered them out to people. We relatively quickly, like within 2 days of doing it, we realised that this was not going to be a solution that we could continue to deliver. And we had to reassess that. We didn't always get it right, but when we learned as we went along, the same as everybody did, and it was some steep learning curve. We also organised and delivered PPE packs to the local community, so other community groups could keep going. Staff were allocated to support community-based responses in Clydesdale. We found these incredible clusters of people who got together and said we must do something for this community, and who were driven by the desire to do something positive and to be involved in something positive. And because Healthy Valleys is the anchor organisation, they came to us and said, what do we do? How can you help us? And one of the issues that they had was a lot of the groups weren't constituted at the time, so they couldn't apply for funding. So Healthy Valleys applied for and secured funding, and were able to then give smaller pots of funding to groups so that they could get up and running and get started. In that first month, we had 194 hours we recorded. I think that's probably an underestimate, but it just shows when you get to the combined stats for June, July and August, and we're on 1,000+ hours of volunteering, how significant the response was. And from our staff team, the same amount of staff went from doing 498 calls to doing over 2,000 calls, over 2,000 texts. The number of food bank referrals we received and forwarded on was triple what it had been previously. We delivered food boxes and food parcels. As I said, it wasn't going to be possible to keep cooking. So when the shielding boxes came out, we applied for funding and topped up the shielding boxes with fresh fruit and vegetables and milk. We also recognised that in a lot of our communities where there wasn't access to shops, people had already gone from March without access to things like washing powder, bin bags, and those weren't initially included in the shielding boxes. So again, we secured funding and delivered 277 packs with sanitary products, domestic cleaning products, personal hygiene, all sorts of stuff. We continued to pick up shopping and prescriptions and drop it off for people who were isolated and couldn't get to a chemist, didn't live near enough or didn't have the opportunity to get to a chemist. And we started to send out wellbeing packs to adults and children with activities in it, anything that we could think of that would keep people going. And also we delivered our first online sessions again for the pre-fives. So it was busy. The legacy of it is far more than I've included there, but one of the positives for us was that where online group activity was successful and available, it was great because people didn't have to get a bus to go anywhere, because they were in their house, so they could access things without having to organise childcare or pay for a taxi or all of those things. So actually, for certain things, our engagement in activities went up. We recognised that there was an increased demand for support with anxiety and stress management, and we put together an online course during the early stages of the pandemic, got it online, and we're incredibly proud that we got that started and from nothing, and everybody who attended the course, it ran monthly, everybody who attended completed. We didn't lose anybody. They all went through the whole course. So I'm really proud of that. The partnership working opportunities were massive. Suddenly there were partners that we'd never dreamt of having before, which was fantastic. During the end of the pandemic, we commissioned a community food consultation into food insecurity and about what we were going to do with all of these people who had become dependent on larders, and how we were going to continue offering support, what the food bank's role might be going forward, and how we could support dependency that was becoming prevalent on that. We also found funding and secured funding for what's locally known as the Wellbeing Wagon, which is going to be a vehicle that is purpose built to deliver health interventions in rural communities. We found that there was nowhere to deliver things from. So one of the first problems that we had was that the community halls closed. So we were delivering food parcels and food larders out of the back of cars, a gazebo which blew away. You know, there wasn't places where we could go in these communities to deliver the things that people needed. So we bought a minibus and we found funding for the Wellbeing Wagon, so that we'll never be in that situation again. And the out of it, we've learned that we need to take services to communities, and that will hopefully enable us to do that. The place to be is going to be our kind of community hub and spoke approach to delivering. In 5 communities, we're going to take over a community venue 1 day a week, and we're going to run a social space in the morning. Our consultation told us that although people at that stage were dependent on support for food insecurity, in general, what people wanted was social space. They wanted to feel connected. And so the place to be is going to offer a social space in the morning, access to a light, healthy lunch, probably soup, because we do a lot of soup at Healthy Valleys. And then in the afternoon, it's going to be more formal group working sort of experiences, the resilient families, weaning courses, cooking courses, waste management, anxiety management, lots of things that we can refer into. So next one, as I say, the learning from it for us, the community response was incredible. We could never ever have expected that so many people would give time, people who were furloughed, our original volunteers. It was just incredible, the response that we got. The fact that online group work was successful, however, it highlighted that connectivity is an issue in rural areas, that not only did people not have Wi-Fi, they didn't have access to Wi-Fi or the equipment to get online. This recognition of social isolation, people suddenly need to be together. I think we see more and more and more when we're talking to individuals and talking to our communities, they're desperate to get back to seeing each other and to being face to face. The lack of community venues, as I said, was a huge problem for us. And we're in a situation that now where we're ready to go back into venues and the council venues are open. One of our hall keepers, sadly, got COVID last week. So although we're ready to go, we still can't use that venue because there's nobody to open it. So we're still stuck, that community's still stuck. It's had a huge lasting impact on older adults. People who were lonely and isolated previously are now more lonely and more isolated, and they're frightened and they haven't moved for a year. So that's going to be something that my team and I are going to have to look for some funding to try and address and really work with our communities on. We also found that a lot of the responses that happened didn't work for rural communities. So the 20-minute neighbourhood model is great if in your 20-minute neighbourhood there are the things that you need. If in your 20-minute neighbourhood there aren't those things, it's very difficult. So that, for instance, the shielding boxes when they first came out contained instant, the milks that you get in hotel bedrooms, that, it's all part of the exotic being on holiday experience. Well, if you're a mum with 4 children and a box of cornflakes and those, in order to give your kids breakfast, it's 50 milks later, it's not quite as exotic or enjoyable as that first cup of coffee on holiday. So people didn't have access to the things that were basic amenities. And the third sector stepped in and bridged that gap until kind of the council were able to respond. And I think we just again have the flexibility. But more than ever, the need for localised support structures was apparent and prevalent. And for me, I think I got asked to do this because I'm the one who's always banging on at Healthy Valleys about how important it is that we do things in communities with communities, and that we understand the complexities of rural living. So if you'll humour me, I'm not really sure how long I've got left, but I would like to see
You've talked for 15 minutes. So if you can keep going, but just to keep it to another 3 minutes, something like that, that'd be great.
I was just going to digress into the reason why I think I'm always banging on about such things. I came to Scotland 20 years ago as a community artist. You'll be able to tell from this incredible piece of work. This was my 20-minute neighbourhood when I was a child. So I lived in this village with a church and several working men's clubs. And this village at the top left-hand corner was the cultural epicentre of my world because it had a co-op and a swimming baths. The rest of the villages were all mining villages. The council, where it says on the right hand side, council housing, that estate was multicultural in that there were a lot of Scottish miners who moved down to work at the pit. And that really was as multicultural as my childhood got in rural Warwickshire. But the reason that I kind of put this up was because these villages that are on this picture are very, very similar to the villages that we still work with today at Healthy Valleys. The same complex histories, the same issues in terms of there was our doctor's surgery, no other doctor's surgery, there was a bank, there was a swimming baths, but unless you could, well, we could get the train to the swimming baths, but these people couldn't. You know, these issues of rurality from 40 years ago are still issues that our communities face today, and that the social determinants of health are intrinsically tied up in those communities and what is available to the people who live in them. And for me, it's vital that when we're talking about planning for communities, we recognise that each community has different assets, each community has unique history, and each community faces different challenges. Often they're the same as urban communities, but they have many, many additional complex challenges, geography, poor infrastructure. And so I kind of wanted to get that message in there at the end. So there you go. You've humoured me on that. Thanks.
Oh, thank you, Ali. I could have just listened to you for a lot longer. You've given us all, yes, many.
Thanks,
Thank you.
Kathy.
Lots and lots of good ideas and food for thought and inspiration, really. So thank you for that. And I'm sure there'll be questions and comments after our last speaker. So I want to just finally introduce Craig, who is the head of policy and research at Commonweal. Many of you will probably be familiar with Craig from his Commonweal podcasts and the many policy papers he's written for Commonweal. And again, I'd like to thank him for hosting this event. So over to you, Craig.
And thank you for having me, and thank you for letting me speak again. Robin does send his apologies. We're all very, very busy at Commonweal, and he ended up double booked for this. So he threw me at you in his stead. I hope I'll be able to do this justice. I wanted really just to talk. We've been talking about the community hubs. Colin's talk there is really the heart of what this is about. And hearing from Ali, yeah, I'm from Clydesdale as well, so that map at the end, Ali, that really chimed with me because that's my neighbourhood as well. Yeah, it's whenever we talk about the 20-minute or the 15-minute neighbourhood, it is so often talked about from a city perspective, whereas it's a very different challenge out in the rural areas. As Colin said, the National Health Service was the opportunity that came out of the crisis of World War II, and the other social welfare programmes that came out of that, changed Britain entirely. And we're facing a similar kind of crisis in the sort of scale of disruption of our lives in the form of COVID, that has really directly laid bare the known problems, the problems that we already saw in health and in social care before the pandemic, and we saw those problems torn wide open by this crisis. But with crisis does come opportunity. So I really hope that we can take this moment to get that reform that we desperately needed before the pandemic and still need after it. I want to really just talk about the genesis of the care reform group in Commonweal, how it came about and the work it has been doing over the last year and a half and the work it's going to be going on to do. And you'll see how the different strands that the various authors in it have been working on are all starting to coalesce into something that we think could be sort of a really important, possibly one of the most important pieces that articles that Commonweal has ever produced. This started shortly after the pandemic really bit in Scotland in May 2020. Nick Kemp, the convener of the care group, approached us and with this proposal for a paper showing exactly where COVID had hit in Scotland's care homes and why it had hit so hard. And showing why that crisis was both foreseeable and preventable. It really opened our eyes to what was going on, and it resulted in us saying that we needed to be doing more work in this. We need to start seeing what other issues we can get involved in. Nick followed up that paper in August of 2020, looking at the response to COVID in retrospect in the care sector, and found that many care homes were still failing standards, even despite the lessons that surely must have been learned even by that point, and found that even fundamentals like the inspection system in Scotland was sorely lacking. So it's not just the systems themselves were failing, the systems that were supposed to support them were also failing. If we go forward a bit to December 2020, the care reform group is now up and running. We have gathered together some of the Scotland's foremost experts in various fields in care, Colin and Cathy among them, and of course Nick, who convenes the group, and started work on the question: if we could design a national care system from scratch, what would it look like? The Scottish Government at this time was also starting to ask that question. And its first attempt at answering it came in the form of the review of adult social care, known as the Weal review. And immediately we saw this is not enough, because it only focused on adult social care. It didn't look at social work, it didn't look at child support, it didn't look at all of the other aspects that are care, nor did it look at the failings that we had noted previously. We did try to engage with the review. We put in a submission to the consultation. We found that the entire project was ultimately limited because it was trying to do too much too fast, but even what it was doing was too limited. The government had completely underestimated the scale of the challenge here. Oops. In January 2021, the care group put out their first major work as a major policy paper as a group, the Manifesto for a National Care Service. Not quite what the National Care Service would look like, but what it should do. What are the principles that underpin a care service that is worthy of that name? Principles like it should be comprehensive, it should cover all aspects of care, should be not-for-profit, should be free at the point of use, should be locally driven. And you can see where the community hub starts to come out of that. It should be preventative rather than reparative. And it should be built around its workforce, not so often in the care sector that carers are some of the least valued people in society in terms of how much we pay them and how many rights they have in their job, despite that vital work they do. My mum's a carer. I see what she goes through at work. Ultimately, what we've said is if you don't treat the National Care Service with the respect that is due to the National Health Service, if we don't treat it as that nation-building project that we saw coming out of World War II, it will fail. It will not do enough. March 2021 was the next paper. Colin showed how, why that concept of care must be more than care homes or elderly adults, as vital as that is, and really going into social work, which is neglected. It's often stigmatized. It's often the last broken net once people have fallen through everything else. Whereas, again, this should be something that is in the heart of communities and playing an important preventative role in helping people really almost before they know they need help. And we see that this has to be something that is integrated intimately with the communities that it's serving. Otherwise, social work just doesn't work. By this point, in May 2021, the Weal review had reported back, and as expected, it failed on the various aspects that we thought it would. The policies it presented, some of them were worthy, but largely they were piecemeal, they were disjointed, they were trying to solve individual problems rather than being a comprehensive whole. And the review largely failed to meet the manifesto principles that the care group published. We were somewhat encouraged, though, that shortly after this review came out, the government itself, Scottish Government, did show signs that it was listening out with just this consultation, and it did say that, yes, an NCS, a National Care Service, should be about more than adult care. And it started to look at other aspects as well. So there was progress here, and people were listening. And I should say the group has been lobbying extensively, both in the sector and within government. It has been doing a power of work, really. I'm not just saying that because they're here. The next paper that came out in June 2021 was the paper that you're here for tonight, that Colin's just talked about, the idea that community hubs should be at the heart of your community, not just in care, but should be the core of your neighbourhood, and should be able to deliver the services that are needed. And please get Colin talking more about this during the Q&A, because I'm sure he'd love to. About this time, we did start looking at at childcare, and the Scottish Government had started doing this as well with the Promise, which has been looking at this issue, and unfortunately has been making some of the same mistakes with childcare as Feely did with adult social care. Again, very fragmented work, disjointed and with no overall strategy, and we did critique them for that. We're not just a body that critiques, though. Shortly after the author of that paper, Mary McLeod, produced this critique, she followed up with her own blueprint for what childcare should look like in Scotland, and pointing out that it's not just about child care, it's about care for the parents as well. I don't have children, but when this paper came out, I did approach several of my friends and family who were new parents and asked them what they thought of it. And one of my friends said that one of the most terrifying things that ever happened to him in his life was when he was handed his son, and the only thing he could think of to say was, "What do I do now?" So I'm sure everybody who's had a child has gone through exactly that. So this is something that is about supporting everybody. Care really is for everyone. We use the term not just from cradle to grave, but from womb to tomb. So slightly morbid phrase, I guess, but it does sort of illustrate that this is something that follows you not just throughout your life, but even before it, and the care service should be built accordingly. So there is a lot more to come from the care reform group. I'm consistently impressed with the stuff that they're doing, and the weekly meetings that we've been having and the discussions that we've been having, and my inbox is always full of the latest thing that has been discussed. We have more papers coming out on the principle of care. What is a really good question that not many people ask and fewer answer. What is care? So we're going to be coming out with a discussion paper of what are the principles of what care actually means. We have papers coming out on health and safety in the sector, training and conditions for employees, because as I said, so often they are the most vital and undervalued part of the whole system. And we're going to be building up to a comprehensive blueprint of what a national care service for Scotland should look like. Nationally planned, but absolutely locally delivered. And as Colin said this evening, community hubs, putting your community and your neighbourhood at the heart of that care service is what will make it work. So thank you for that. I'm going to keep things quite tight, because I'm really interested to hear some of the questions and the discussions that go on from here. So very, very quickly, just to say, as I always do at the end of all of my talks, part of my contract, I have to say, Commonweal as an organisation, we are entirely funded by folk like yourselves who give us regular donations or visit our shop and buy our books and our merchandise. Go onto our website, commonweal.scot, find the policy papers, not just from the care group, but from on everything else as well. And if you would like to support us and help us support the folk like the Care Reform Group produce their next paper, then if you can offer us a donation, and many of you have tonight, I know, but if you can offer us a donation, either a one-off or a regular donation, we'd really appreciate that. So I'll pass back over to Kathy now, and I'm really interested to hear what you all have to say. Thank you.
Okay, well, thank you so much, Craig, and for giving that overview of what's been happening with the Care Reform Group, and we will be keeping going over coming months in terms of trying to put together ideas and arguments and thoughts for the future of social care in Scotland. Okay, I'm going to open it. We have we have a bit more than half an hour because all the speakers have been great and kept to time. So I'd like to open it up now to questions for the speakers and comments, but there are a lot of people on the call, which is great, or on the Zoom. So if you could keep your contribution and your questions fairly brief, then we can get as many people as possible in. And I already have one hand up. If you want to put your hand up, if you go to reactions at the bottom of your screen, you should be able to see a raise hand button. So hopefully that will work. If you can't find it, then wave to me and Craig and I will try to find you. But Simon.
Hello, can you hear me?
Yes.
I'm coming at it from a careers point of view. And here's the thing, professionally speaking, care work sucks. If I say to a young person, like, if they ask me about care, very limited promotion prospects. I meet people in their 40s and 50s who've been in care with decades of experience who are still getting £10 an hour. A lot of it is agency work. A lot of these care organisations are quite fly-by-night due to this financialisation, you know. So how do you see the profession, like the level of qualifications, people doing degrees in care, that kind of thing, and being paid proportionately to their qualifications and experience and the difficulty of the work? How do you see that developing as we go?
Thank you very much. I think I'll take a couple of questions if that's all right, and then I'll go back to the speakers. So Simon, thank you for that. And I could talk all night about that, but from a trade union point of view, if nothing else, but it's a great question. I'd like to go on to Robin.
Two quick questions, one for Colin. Why is it that the community idea is not on the radar of the Scottish Government? He said that it doesn't seem to be an idea that's at the forefront of their minds. And a quick question for Ali, how is her work or the work of her group received by the local service providers?
Okay, and I'll take one more. I think the next person was Andrew Reid.
Hi. Oh. Okay. I've got a fair amount of experience, so the last 10 years of working in and with community groups. I'm a bit concerned that this approach is buildings led. I know it's a lot more than that, but simple question. In terms of the notion of what a community hub looks like for that scale of population, how much does it cost to build a community hub? What's the capital cost of actually building it?
Okay, thank you for that. Just a small question. All right, I'm going to ask the speakers to respond to those three questions. So we've got the one about care workers and education and pay and conditions, and we've got one about why are community hubs not included in the National Care Service, and a linked question, which is the question of the cost of building a community hub. So can I go to Colin first?
Hi, yeah, I'm going to pass on the one about pay and conditions, because I really think, Kathy, actually you should answer that as the author of our paper on health and safety in workplace and so on, and that aspect of things, our paper that's coming out very shortly. But I will talk about why communities are not central, or don't seem to be on the radar of Scottish Government. In fact, that's not quite correct, because they are. Communities get an awful lot of mentioned, but it always seems quite token. The fact is that social work, which is the area that I know most about, has moved away from communities steadily since the implementation of the 1990 Community Care and NHS Act, which brought the market into social work and social care, and made social workers gatekeepers and assessors. And so, and that immediately, because I was involved in social work at that time, and I was hit by that transition. At the same time, children and family social work, which I also know quite a lot about, having done that until I retired a couple of years ago, child protection and so on, that became proceduralized and obsessed with risk, usually risk to the local authority and the employer rather than the individual child. So that whole tendency has taken social workers out of communities. It's made them very remote, and it's in offices that are often inaccessible, literally inaccessible, in that members of the public are not particularly welcome in them, and certainly not into the areas inhabited by staff. And it's made the whole process one that social workers find themselves doing a job that they didn't train for, and become cynical and overburdened and leave the profession to those that are prepared to put up with that stuff. So whilst there's talk about communities, the services that are provided for communities have been removed from them, and that's a tragedy, and that's something that we need to address. And the Struggling to Care paper that Craig referred to goes into that in some detail. I'm going to move now just quickly on to the final question, which is about community hubs. Have we costed them? And no, we haven't. And if you read the paper, and this is perhaps sounds like an excuse, and maybe it is, but if you read the paper on community hubs, you'll see that we don't believe we should be prescriptive about it. We've given some ideas about how we think they could be conceived and the kinds of services that they could deliver, but we haven't costed it, because we feel their design and shape should be made by local communities in partnership with service providers, including particularly local authorities and health providers. And important third sector organizations like Ali's one, but we've deliberately not been prescriptive. Oh yeah, indeed, all this will require a huge amount of investment, and there's no getting away from that. In Commonweal, we're socialists. We don't believe that the priorities within society are necessarily good ones. We believe that the money and the resources are there if they're just distributed a bit more equitably and invested in communities rather than in holidays and holiday houses and so on for millionaires.
Okay, I've got quite a few other hands up, but I'm going to go to Ali now, because one of the questions, Ali, was how your services, what you do has been received by local service providers.
I think I've been with Healthy Valleys for 3 years, and as I say, I wanted the job because it's a well thought of organisation, and I can honestly say that the work that we do is received and is respected, you know, across the board. I think we've got partners in health who, as I say, know that we can reach people who they can't reach, and we're constantly providing support around, so, you know, the oral health and a lot of the sort of strategic delivery targets that people are being asked to deliver, you know, from government level down. We're there providing the practical access on the ground for people to be able to kind of buy into those things. We take a lot of referrals from social work. I know our children and families department have a huge amount of referrals, and people don't have the time in, you know, in their working week to provide that individual kind of support and nurturing. And I think that we aren't the only organisation, but third sector organisations, voluntary organisations provide that little bit of extra time that enables our partner organisations to do their bit of the job and us to support the individuals to get them where they need to be. So, you know, I'd like to say that the work we do is viewed very positively.
Yeah, that's quite hopeful, I think. You got a thumbs up from Robert. Craig, do you want to add anything to what's been said in relation to those questions?
Just very, very briefly on the care career prospects question, although again, Kathy, you're the expert in the room on this. I can only sort of echo my mum's experience as a carer that, yeah, it is a sector where, as it's currently constituted, it's quite difficult to get people in and build a career with a sense of progression to it. I don't have an answer there because I'm not a carer, so I'm going to pass over to Kathy on this, but it's certainly something that, as I say, the workforce should be much more valued than it currently is.
Yeah, I'll be brief because there's so much to say, but it was just that our vision, I think, I mean, we've tried to do some work about looking at what the problems carers face, you know, and this has already been said by people, you know, people are low paid, they're on 0-hour contracts, they have no guaranteed working hours quite often, people are working, you know, they're going into people's homes for 15 minutes, they can't possibly do any kind of proper care for that. There's just so many issues. People are having to quite often do training in their own time, pay for the training themselves. Our vision really is that social care workers should first of all have some training and education before they ever start, just like in the health service, so that, you know, you have an input. It may not be a huge amount at the beginning. I mean, we'd like that to grow, obviously, but there should be training and education before you start. There should be continuous training and education as you go along. That should be recognized. That there should be good support and supervision, which there isn't for a lot of social care workers now. People are getting they're getting, you know, their orders on the phone and they have to go to somebody's house. They're not given the support. We would like, what we're calling for, and to some extent the consultation document says this, but to some extent it doesn't, is that there should be national sectoral collective bargaining for care workers, so that all care workers are treated the same, that that there is national bargaining about that with the government and with trade unions, and that there's progression, so people know that if they go into care, there will be you know, a progression into the profession, if you want to say that. So I could go on, but those are some of the things that we've been talking about. And, you know, health and safety is a big issue for care workers, lone working, violence and aggression, lifting and handling, all sorts of things. And all of that needs to be tackled if we want, first of all, their experience to be good, but also the quality of care that they can give to be good. So I'll shut up then, but you know, we can obviously go back to that. We've got a number of other people's hands up. I'll maybe take all, there's 4, so I'll maybe take them all. If you could keep it fairly brief, and then I'll go back to the speakers again. So I think the first one is Mike.
Hi there. Sorry, I dropped out with my signal because I'm on phone rather than broadband, so apologies. I hope you can hear me.
Yeah.
My question was about the role of democratic local government in all of this. Colin touched on it, but it seems to be a key missing element in the plan, and I know it's caused a spat between the COSLA, the Convention of Scottish Local Authorities, and the Scottish Government over their plans, the Scottish Government's plans for the care service. But I wondered what the panel's view on what the role of democratic local government, because it seems to me that a key element that's missing from this discussion on the National Care Service is, if we're going to make it local, how is it going to be democratically controlled? And the only way, it seems to me, is through local government. And if I could just make an observation on the NHS that Colin talked about, centralising influence of the NHS. Craig quite rightly showed the Beveridge report, but the plan for the NHS wasn't what was in the Beveridge report. What was delivered for the NHS wasn't, and it wasn't the Labour Party's plan either. The Labour Party produced a really important report in 1943 called a National Service for Health Plan that proposed two key elements of the what became the NHS, one of which was that local authorities would run the vast bulk of services and it would be built from the bottom up. And the second of which was that there would be in each area the ability to set up health centres, which were in those days envisaged as multi-discipline centres involving GPs, midwives and health visitors and so on and so forth. The control by local authorities was actually written out of the legislation by Aaron Bevan. The Socialist Medical Association at the time never forgave him. They considered it a complete sellout to the hospital consultants who refused to work for local authorities because they considered it demeaning to work with bin men and midwives and teachers and other such people. They wanted to have a separate status, and Bevan wasn't prepared to confront them, so he nationalised the hospitals, took them out of local authority control. Hundreds of them, I think 2,000 altogether, were actually in local authority control. And he took them out and created this huge quango network that then just grew and grew and grew and took over all the services that local government retained at the time of the NHS. The danger is that we're going to replicate all of this history with the National Care Service if it isn't built from the bottom up. We're not going to have the local centres and we're not going to have democratic control. So I want to ask the panel, what do they think about the importance of democratic local government in this, and how can we both transform local government to have a vital stake in it, and how do we persuade the Scottish Government and the Scottish people that there should be some form of democratic local control over this service?
Thank you, Mike, and thanks for that historical perspective. It's very helpful to have had that said. I think the next person is Alison.
Sorry, I'm having trouble unmuting as usual. And it's probably more of a discussion kind of point. So I work with the Scottish Association for Social Work. I know some of the people on the call, which is wonderful, glad to be here. Great to listen to Ali's work, fabulous, kind of really kind of bridging that gap between, I suppose, health and social work and social care, and getting that, you know, she talked about individual support and nurturing, and how that social services and informal social services simply can't do that bit of the job at the moment. And so I suppose, you know, obviously Colin's a social worker, me too, really kind of thinking about what the job of social work has become, and Colin and Nick have done lots of great work on kind of the historical explanation of this. But how do we get back? I'm really interested, and my members are really interested in terms of how do we get back from being this crisis interventionist, last stop, you know, as statutory unwanted intervention comes into people's lives, and kind of become much more the service that social workers certainly envisage that they are, and come into the profession aiming to be, and kind of how do we do that? So I suppose it was a comment on that bit of the job, if you like, and that kind of balance between where does health become actually social care and social support, and how people are leading their lives and where they are. Listening to the conversation about buildings and the hub, and thinking about, you know, that there are many alternatives here that may not be quite what the community hub, as Colin is talking about, is envisaged, but the social work, you know, why aren't we in GP surgeries? Why aren't we in community centres? Why aren't we embedded in schools where families come with intergenerational kind of issues? And I mean, I think you're right. We don't know what the Scottish Government view of community is, but certainly in my conversations with them, the notion of community social work is now becoming, I mean, I've heard it not just from me, you know, several times in the last few weeks as something that needs to be discussed and talked about and might be something to aspire to. So yeah, I mean, again, I'm thinking about the one-stop shop. I thought Colin's kind of description of that, as always, is spot on in terms of it's a one-stop shop for signposting. How do we become more than that? And I guess I was thinking of the way that health has done that is to have GPs. We're all signed up to one. It's non-stigmatizing. It's, we know where they are, we can get to them, and they not just they signpost us where we need signposted. You know, you can get something over the counter for this. But they feed us right in to either the generic health support or the specialist health support that we might need. So I kind of just want to put that out there.
That's really helpful, Alison. Thank you. And we have had discussions about all of that. So you'll hear back once the speakers get a chance to come back. So I'll take one more, who is Jeanette.
Hi, thanks for that. It's just a thought when somebody was saying how much is it going to cost to build these community hubs. I thought, well, we've got them everywhere, haven't we? We've got schools everywhere. And as somebody who, like Colin, in the sort of 90s, worked in social care, but felt very much that my job was not helping anybody, and moved into colleges to teach in health and social care, where I think I really have provided a lot of social care to many children who are care experienced, young mums, a whole range of different groups of people. So don't forget, when you're talking about national care strategy, the role that colleges play in that, and it's a massive one. And we're also part of the training of the care force. And when somebody was saying, yeah, kids coming to them in school, they don't want to be carers, but many working class girls in particular in school do not get very good careers advice, and often drift into care work because it's unskilled work and it's where they're allowed to go into, and they feel quite good at it and they enjoy helping people and a whole range of stuff like that. But for me, to improve their lives, it's exactly what Kathy was saying. It's national care provision, it's national standards for all of them, like we have in teaching now in Scotland. In the Scottish colleges, we have a sort of silver book, if you like, a book of care conditions, and that's what they should have, I think, in care work. My problem with it is, though, I've seen over the years, is the more it moves over, and much as it's beautiful to hear the lovely story about Ali's fabulous group, you know, that fabulous organisation and the work she does, the more it moves over to the third sector, the more I have seen wages and conditions falling, because there is nobody to overall control what's happening, and there's a big expectation of free work coming from working class women. You know, the 15 minutes, you know that they don't do 15 minutes, they do half an hour, and they use their own time to do that extra work. And so I totally agree that if we don't have democratically elected like councils involved in it, and if it is just privatised or even third sector, if that's all the employers are in the care, then wages and conditions will not improve. But please don't forget colleges and the roles we have. I think, for me anyway, coming from social work into college, I feel as if I've done more help for people working in colleges than I ever did, because it became, as Colin said, it became that sort of risk assessment stuff. It became risk avoidance rather than actually helping people through crisis. Don't forget, we have community hubs are there. You've got schools, you've got secondary schools, you've got colleges, you've got all that facilities there. Involve them. Most of them, like Kelvin Colleges, certainly seems to be very open to helping, like they do with the care experienced children, helping any kind of area of care. So use them as well, and make sure they're part of your national care. sector. Thanks.
And that's really helpful, and I, you know, it's good to hear what you're saying about working class women. Well, lots of women, but going into caring because it's something they can do because it's unskilled, but also loving. And you know, one of the things that we get from social care workers, that, you know, the pay is rubbish, the health and safety is not good, but the caring side is what they want to do. And what, you know, I think what Colin's talked a lot about in our group is that care is based on relationships, and that, if, you know, the people who are providing care need to have the capacity to build relationships with the people that they're looking after. So I'm going to ask each of the speakers to respond to those various questions. We got the issue of where does democracy come in and accountability. We've got this question that Alison posed, which is how do we get back? How do social workers get back to, in a sense, what they want to be doing and what they're meant to be doing? The issue of national standards and the use of schools and colleges. So lots there. I think I'll start with Ali. See if there are comments you want to make on all that.
Yeah, not really.
You don't have to.
Is the honest answer, aren't I think I don't know enough about democracy and accountability, but I know enough to know that if it doesn't include the people who are doing it in the planning of doing it and the people that it infects in how it's built, then you're right, it's not going to work. I think that there are lots of other buildings, like things that are on the community asset transfer lists, that could also be used without having to start from scratch and rebuild buildings. Or, you know, there won't always be space in buildings that are used, but there are lots of unused buildings that could be utilised in communities. And I think that from a third sector perspective, bit of a royal we there. I think that quite often we have the job of mopping up bits that nobody else really has the capacity to do. I think that there are a lot of organisations who would quite happily, I apply for funding for things and I say, like, if you'll just give us 2 years funding, then we'll do this. The reality is that it needs investment for 5 years or 10 years or 15 years. It needs a commitment to the people, it needs a commitment to the communities. And part of that is looking at the people who care and about the aspirations of those people and the way that those people are viewed throughout society, and the value that is placed on people's safety and people's ability to live better, healthier lives, and who enables that to happen, whether that is colleagues in social work or whether that is people who go in for 15 minutes. And, you know, there's got to be some recognition of how important it is, and that be valued. Doesn't really answer any of the questions, but I feel better for saying it.
No, it doesn't. It's very helpful. Okay, and if I could go to Craig.
Yeah, 3 problems with the concept of democratic local government in Scotland. 1, it's not local. 2, it doesn't nearly have enough ability to govern. And 3, sometimes it's not very democratic, especially when some decisions are made behind closed doors that you'd really rather weren't. We actually have a paper called Development Councils, which envisages a system of local government that actually is local in Scotland. The kind of municipal level government that other European countries simply call normal. We are a strange country in not having that kind of local government. We're one of the most centralized countries in the Western world. So we do need to start pulling powers, not just from regional government down to local, but also from national government down to regional, or national government down to local. Absolutely some sort of national scale strategy when it comes to a national care service, and things like national collective bargaining on wages, very, very powerful. You don't want a postcode lottery on salaries. but you do need the power to deliver locally, and that's going to mean reforming local government to a great degree if we really, really want to knuckle into that. So yeah, that's one of my big passion projects in politics, is to try and get a kind of democracy in Scotland that other countries call normal.
Thanks, Craig. And before I hand over to Colin, he probably was going to say this, but I'll just say that our line, if that's the right word to put it, in the care reform group, is that the national structure should be set up at Scottish level, that collective bargaining should happen at Scottish level, that resources should be put in at Scottish level and not left to local authorities. They should be ring-fenced national resources, but that the actual provision of services should be done through local authorities. And, you know, Craig's point is well taken, but at the moment, the local authorities we have would have to be the ones that would do it. And then beyond that would be the kind of structures that Colin's talking about, the community hubs and everything. But I'll hand over to Colin for the last word.
Yeah, thanks very much, and brilliant questions. And Jeanette, you're absolutely spot on in your description of the race to the bottom in social care, and well done for highlighting the role of education and the colleges that you work in as an experienced social worker. That's brilliant. On the question of local democracy, I think that's really been covered. What we're not going to get from the proposal for the National Care Service is any semblance of democracy. The IJBs and HSCPs have failed. That's our position in the Commonweal Care Reform Working Group. They've not worked. That idea that if you bring services together, then somehow they're better has failed completely. In fact, all that's happened is that social work has turned out to be completely dominated by health considerations now. And that's not been good for social work, and it's not been good for social care. So our position is that whole concept should be dumped, that the NHS should be the NHS, and a national care service should provide social work and social care. On the Alison's point, I think she knows what I'm going to say here, and she answered the question herself anyway. We have to move social work back to communities. And the reason that social workers are caught up in the absolutely overwhelming amounts of statutory work is because they're not permitted to do the preventative work that might prevent problems from getting to that crisis stage in the first place. You know, it really is as simple as that. And I know that from my own long experience in social work, that when we had the opportunity to work with families and with individuals from an early stage and build those relationships, sometimes over years and years and years, then we got the opportunity to head issues off, and we got and head problems off, and we should get the opportunity to do that again. And that's a brave step, and I'm pleased to see that actually some local authorities are beginning to look at that now. And that really echoes what Alison says, that people are beginning to talk about community social work as a concept. And I hope that our care reform working group have had a part in that through banging the drum for community social work over the last period. And we will continue to do that. And I personally will continue to do that as well. So the whole idea of hubs, it's not about buildings, it's about trying to establish local methods of service delivery that fit with community networks and fit into communities and are governed by the communities that we serve. It's certainly not about buildings, and that is, to echo again, Alison, that is about social workers moving back out to the places where people gather and meet and expect other services. At the moment, your typical social work office is a city centre building with hot desking, hundreds of hot desks where people can't even meet together, never mind with the community networking within the communities we serve. And that is frankly ridiculous. And we have to move away from that. And I think there's an increasing recognition of that, but we have to keep pushing because it's much, much cheaper to carry on doing what you're doing. It may not be effective. It may burn out social workers, and it may be cheaper to ask third sector organisations and volunteers to do some of the stuff that social workers should be doing, but it simply doesn't work. And we need to let people do what they're trained to do. And I think social workers are increasingly frustrated at going through intensive training and then finding that they're asked to do a completely different job of form filling and procedural assessments. That's not what social workers should be about, and we need to move them back to communities. And I think I'm going to hand back to Kathy now.
Okay, well, I don't know what to say to finish up. I think it's raised a whole load of issues. I think you know, what we're trying to aim toward, I think, is a strong public national care service with some third sector involvement. I think, you know, to push the boat out and make us all think. But we're certainly in the care reform group hoping that the end result will be to take profit out of care, and that, you know, we will be looking at public services and to some extent third sector, and to protect the third sector from becoming the cheap option by building in good resources and by building in good, you know, collective bargaining, so that all care workers are, as in the health service, are on similar paying conditions and education and support and supervision and all that stuff. So I think it just is time for me to say thank you so much for all coming and participating, and we hope it's been useful. And you know, we will continue to work as a group, and if anybody's interested in finding out more about what we're doing or talking to us more, please do get in touch. And I would just finish by saying thank you to all the speakers who were great, and also to echo Craig's request that Commonweal does rely on donations. We know some of you did make very generous ones. If you can make a donation, that would be hugely helpful. The Social Care Reform Group relies on Commonweal to publish all the papers and all those things. So anyway, thank you very much for coming.